Hello and welcome to another conversation with me, Aman, and thank you so much for being here with me today and for your time and for your participation. Today we're going to be speaking about different kinds of grief, and sometimes it's assumed that grief is only one kind that we all experience when we lose somebody, but that's a very simplistic understanding of what grief is. Grief can be quite complicated. It can show up in many different ways, and I think this is a good point to also dispel certain myths about grief. One of them clearly being that grief happens in stages. That's just not true. Grief does not happen in linear stages. Yes, there are things that we experience and many of that are common, but grief for different people can show up in many different ways. So the reason why it's important to dispel this myth is it perpetuates a lot in popular psychology, in magazines, in television and movies, that we're all supposed to experience some kind of linear stages of grief, whether that's denial, bargaining, the ones that came from the works of Kubler-Ross, which was actually a research in a very different area. It wasn't to delineate the grief that we should be experiencing, but somehow it's perpetuated the myth. So one thing, I suppose, right at the start of today's conversation is let's try to move away from the idea that grief is linear and that grief happens in certain stages. Grief is a very messy picture for a lot of people, and it's like a roller coaster. You can feel that you're getting better, then suddenly you have another dip and you can go round and round in circles, and then again feel that life is stabilized a little bit before you know it, there can be another fall and another rise. So that's a more accurate picture of the experience of grief, but there are very different kinds of grief, and what we normally refer to as normal grief is something that we can say it's natural. It's a natural response to a loss. It's a natural response to the loss of a loved one, and it can involve a range of different emotions, some of them being sadness, anger, feeling guilty or feeling confused, feeling upset, feeling quite upset or sad. So there can be a whole range of mixed emotions, and this type of grief usually becomes less intense over time. There's a phase right at the start where it can be more chronic, which means that it's a form. The grief, the emotions is extremely intense, but it tends to lessen over time. So we call that initial phase of the grief response sometimes as acute grief. But I want to talk about some other type of grief as well, because in normal grief, usually the intensity of the various emotions lessen over time. We don't really get over grief in any way of understanding that we move away from our attachment or our love relationships. The form changes, the shape changes, and the intensity of the emotions lessen over time in a normal pattern of grief. That's what we see in most people. But that doesn't mean it's the same for everybody. A lot of people can experience unintegrated grief, which basically means when grief can get stuck. So one of the things to remember is, while the normal pattern of grief might be you feel the acute grief, you feel the intense grief, but it lessens over time, moving towards integration of grief, where the emotions become less intense, where there's also a sense of acceptance to the death, that there is an understanding that the actual physical loss of a loved one has happened, and over time there's an acceptance of that. Slowly over time, people who are bereaved, who have experienced that loss, who are experiencing the grief, would tend to still feel the yearning and the longing. However, that doesn't mean it remains intense all the time. People start going out, they're able to get back to things that they used to enjoy, start enjoying the company of other people, become more social, start feeling that it's okay to experience moments of fun, moments of happiness as well, where there's a sense of acceptance that you still remember the loved one, but you're able to focus on other things as well. You don't get stuck in the memories. But this is when grief integrates. When it gets stuck, there can be a very different experience for a lot of people. That that acute sense of grief, the pain, the emotional pain which was felt right at the start doesn't seem to lessen over time. It feels very prolonged. It feels like I feel exactly how sad and upset I felt, for example, maybe even years down the line. There's still a difficulty in prolonged grief, or when grief gets stuck, that perhaps the death hasn't happened. So there's a sense of difficulty in accepting the finality of the loss. There's a difficulty of accepting that the person has died. There might be intense longing, a lot of yearning for the person to come back. So this impacts the ordinary functionality of the person who's bereaved, that they're not able to focus on other things, that they keep yearning for the person to come back, or they're preoccupied with the thoughts and memories of the person, finding it very difficult to be in social company with other people. They might start avoiding the company of other people. They might feel something wrong if they feel moments of joy or happiness, as if they are betraying their loved ones by feeling happy, by feeling joyous. And a lot of those things can lead to a sense of guilt or a sense of shame or feeling even more upset. And it doesn't seem to be resolving or integrating over time. So that's a difference between integrated grief and unintegrated grief, or another way to say it, that's the difference between a normal pattern of grief versus when grief gets stuck. But there are also other kinds of grief that are not just about the loss of a loved one, where we can acknowledge that loss, and somehow the society is able to come together and it's normalized that you are allowed to feel like that. That's not always the case. One of the loss type of grief that we experience is known as anticipatory grief, which is basically grief that occurs before the loss has actually happened. It is anticipatory. Now, this might be, for example, when we have a loved one who has got terminal illness, perhaps cancer, or that they might be experiencing a major loss in their life. The grief can be felt by people around them. It can even be felt by the person themselves. But there is sadness, there's anxiety, there's fear, there is dread about almost an impending loss which is about to happen, but it's not happened yet. This might be loss of livelihood, loss of functionality, to see persons that you've loved change, perhaps due to illness, perhaps losing their memories. We sometimes talk about anticipatory grief in situations where people have had a cancer diagnosis or a loved one has been diagnosed with Alzheimer's. So these are examples of anticipatory grief, again, where the loss hasn't actually happened yet, but because it is impending, because it is a diagnosis perhaps of a terminal illness that is taking its course, you start feeling the loss for the person even before that loss has actually resulted in a physical death. But this is really hard on people. It's very important to understand when we talk about anticipatory grief, there can be a lot of sadness, a lot of tearfulness, feeling guilty about feeling the grief of losing someone who's actually there. So it's a very confusing reaction that people can have. There can be anger and irritability on how this happened. There can be a sense of looking back, entering into our negative automatic thoughts of the should, could, would kind of a narrative of, if I hadn't done this, this wouldn't have happened. If they hadn't done this, this wouldn't have happened. This shouldn't have happened. This couldn't have happened. An increased sense of worrying as well, concerns of the dying person, worrying for the person who's received the terminal illness, but also in some ways preparing for that loss. There might be visualization or thinking about things that haven't happened yet, for example, a funeral in the future, or rehearsing how will we react when the person has died. And then this kind of rehearsing or visualization can also lead to feeling guilty or ashamed of having those kinds of thoughts. It's a very confusing, upsetting process for a lot of people. That is anticipatory grief. Another one which can be quite difficult for people is known as disenfranchised grief. And with disenfranchised grief, we need to understand that it's actually a bit different. Disenfranchised grief happens when we're talking about a loss that cannot be openly acknowledged, where for some reason it's not okay to express one's emotions of grief when the grieving doesn't fit with the society's attitude towards that loss, towards that death. And people who are experiencing disenfranchised grief can feel a lot of loneliness, isolation, but also prolonged pain because they're not able to openly express their grief, their loss, because of societal taboos, for example, or other reasons. Now, might be a lot of reasons why this happened. Let's talk about a few examples of disenfranchised grief. So let's look at the medical profession. A lot of nurses, a lot of doctors, medical workers, therapists, psychotherapists, counselors, they work with people experiencing grief and loss, and oftentimes have patients and clients who die during the course of treatment, during the course of therapy, during the course of the medical procedures. But because this kind of loss happens frequently in many professions, loss is somehow built into the part of the workplace culture that the idea in some places is that this shouldn't personally bother you. It's your professional role to deal with the death and dying, and you need to kind of shield yourself and put boundaries, and you shouldn't be affected by seeing people die or losing patients or losing clients. Unfortunately, that's not how the human psyche works. We are impacted by seeing loss and tragedy, and the sufferings of other people can affect us as well. It's called secondary loss. It's called secondary trauma as well. But when, for example, people feel that it's not okay for me as a medical professional, as a nurse, to openly grieve, to talk about my emotional pain, to talk about my suffering, that I have to create this illusion of getting on with it and then moving to the next client and then moving to the next client, that can be an example of disenfranchised grief. Another one is when, let's say, someone is in a relationship that's not legitimate, or losing an idea of a relationship, of feeling really close to someone at many levels, but not able to acknowledge that. Therefore, when we lose a loved one outside of the norms of societal relationships and how that should be, the person who's bereaved may not be able to acknowledge that loss, may not be able to mourn that loss openly, because it's not appropriate in societal attitudes and societal views. If there's any kind of taboo that's associated with the death as well, can lead to disenfranchised grief. So when we lose our loved ones to, let's say, a criminal act, a murder, for example, or lose them if they take their own life, if they've been in a drug overdose, if they've experienced some kind of death which has taboo attached to it, that can be very hard to talk about as well openly within society, as people can oftentimes not be very understanding, and conversations like this can feel awkward, or some people even feel that they're not allowed to grieve the loss of a loved one who died in circumstances which are not necessarily societally accepted. But even if we dig a little deeper, as a society, a lot of different societies find it difficult to talk about miscarriages, or loss of children, or loss of infant death, or perinatal death. People find it difficult to talk about infertility. People find it difficult to talk about loss that arises out of stillbirth or abortion, and the grief around this can also result in the parents feeling disenfranchised and not able to speak about their losses, not able to grieve the loss of the child. Sometimes it's for cultural reasons, sometimes it's for religious reasons, but they have to put up a face. In some cultures, they have to pretty much ignore the fact that this even ever happened, and they just need to move on, not think about the loss. And again, like I said, there's no right or wrong way to grieve, but the problem of disenfranchised grief is when people want to grieve and they feel they need to grieve, they're not given the space and the opportunity and the empathy and the compassion or the non-judgment to be able to do so. Some examples of disenfranchised grief are, let's say, a loss due to addiction, a loss of an ex-partner. So sometimes people feel that I shouldn't mourn the loss of an ex-spouse for whatever reasons, but that's not okay to openly grieve the loss of that relationship. But relationships are complicated. We can have mixed feelings. Our relationships, our lives are not black and white. It's not that we either need to love somebody or hate them. There are so many grays, and if you look around in the world and the colors, there are all sorts of colors. And this idea that we have to somehow decide in terms of very concrete ways of thinking, whether we like them or we hate them, whether that was our relationship or now we have to ignore it, that complicates human experiences. So that also, for example, applies to the death of somebody who was not very kind, someone who was not nice to you, or who played a mixed role, whether that's come out from a parent who has been unkind or abusive towards a child, but still the loss of that parent can be very confusing to the child. Same in a relationship, that part of the experience might be anger and irritation and even perhaps relief at the death of somebody who's abused somebody else. However, for some people, it's not for everybody, but for some people, the experience can be quite complicated. There might be sadness and grief over the loss of that relationship as well, about the good things that they experienced, about the happier moments, about what that relationship could have been. So grief is not always clear. We can have mixed feelings towards the loss of a loved one. For some people, the death of, let's say, someone who's not been very kind to them can be quite a relief. But for other people, it can be very confusing. And for some people, it can be completely devastating. Similarly, let's talk about disenfranchised grief in another context, which is, let's say, the death of a pet. For many people, their pets can be like family, can be family. And when they're not able to openly acknowledge or display their sadness for the loss of a pet, they might feel quite disenfranchised, might feel quite that people don't understand, and somehow they're supposed to get over the loss. Very unhelpful suggestions can be made in many experiences of grief, like, oh, why don't you just get a new dog? Or why don't you just, you're still young, you're going to find somebody else, and you need to, let go of the old relationship. When people give comments and feedbacks like that, we need to understand, where is the discomfort lying? Is it in the person's grieving, the one who's bereaved, or is it in many of our inabilities to hold that space in a compassionate and non-judgmental way? And instead of being there with the person, is it our tendency to just want to not be in that situation for long and get them out of this difficult place as quickly as we can? Which might come from a good place sometimes, but it may not be very productive. In fact, it can be quite counterproductive when we rush people out of their grief. Moving into a new community sometimes, leaving your country, leaving your home, your family, moving into a new place can also be a sense of disenfranchised grief, where you're supposed to be happy about the move, you're supposed to integrate into the new community, not realizing that so much of what has been lost is still being experienced. And if the society around you does not facilitate channels to actually grieve that, to allow for that expression, then that can result in a form of disenfranchised grief as well. There are many other examples like that. There's about infidelity, losing a job, for example, or let's say, like I gave that example earlier, losing a patient in the medical profession, losing a client, people would work with, sometimes losing a colleague, but the workplace culture can be such that you're not allowed to express your grief beyond a certain point because people expect you to get on and move on pretty quickly. So those are some examples of disenfranchised grief, and we spoke earlier about anticipatory grief. Then we have something known as collective grief, and that's grief that is experienced by a group or a community, or in some cases even by a whole nation. That might be a loss or tragedy resulting in, let's say, from a natural disaster or a terrorist attack or a societal crisis or a very upsetting crisis in community. We hear a lot about school shootings, for example, or we hear about children who take their own lives in schools, or students who do that in colleges, and that can impact the whole community there. Because this is really important to understand. When we lose somebody, it's not just the family who is impacted. Communities are impacted as well, and on some scales, whole nations and even the world can be part of a collective mourning, collective grieving of a loss that impacts a lot of us. We sometimes hear news of a tragedy happening in a completely different part of the world, but that can really stick with us as well. We can feel that loss. We can feel the compassion and the empathy because we relate to that. So that's an example of collective grief. I'm trying to remember what other kinds of grief there were. One of them is also, well, there sometimes different terminologies are used, but there's masked grief, which is when people are unable to show outwardly the kind of behaviors you would expect in grief, such as sadness, feeling upset, irritated. And there's almost that sense of, I need to get back, I need to distract myself, this is not okay for me to feel. And as soon as those emotions start coming up, there's an effort put to suppress it or put a mask on it or minimize it and say, I don't know how I got so sad, I don't know why did I get so upset, as if there's something wrong in feeling upset. So the ways in which people might try to mask the grief is an example of what we call masked grief. Then there is other types of grief as well. And we're not going to cover every single one of them in this conversation. It's just to get the conversation started. But there's also complicated grief. And this is also recognized in, partly recognized in the DSM and the ICD, which is the International Classification of Diseases, and the Diagnostic and Statistical Manual for Mental Health Disorders. These are psychological classifications systems. But anyway, chronic grief or complicated grief is another type where the grief, which is what we kind of started with, gets stuck, and people can feel the same level of intensity of grieving, the emotions, the sadness, as if the grief has just happened, that acute phase of grief, even years after the loss has actually happened. There's a complete denial that the loss has happened. There can be a lot of anger. There can be a lot of shame that for example, some people might feel that if they didn't visit the grave of the person who has died every day, then somehow they're letting that person down. Somehow they are betraying that relationship. And this is not to say that there's anything wrong with visiting the grave of a loved one. That's completely okay, as long as that's working, as long as the person feels functional in other aspects as well. But when they're trying to be functional and they're not able to because they have to shut everything down to commit to certain acts that they feel they have to do, that might lead to complicated grief. Now, if we look at grief from the perspective of attachment theory, who gets stuck in grief? Where does grief get stuck? We see a lot more in terms of the evidence that we have from research. A lot of people who have insecure attachments or unresolved attachments are more at risk of experiencing prolonged grief. Many times, for example, children who have to enter the role of parentification, where they end up looking at the emotional well-being of the parents from a very tender young age, for whatever reasons, if they can experience prolonged grief because that relationship can feel quite complex. Now, we wouldn't have time to go into detail that, but just for example, when you become responsible for the welfare of your parents and then the parents die, it can, for some people, that can feel like a personal letting down, as if they had to do something to keep their parents safe, as opposed to the other way, where parents are responsible for the well-being of the children in the young ages. So those kinds of relationships where attachment is insecure, whether anxious, avoidant, or disorganized, the chances of prolonged grief or more complicated grief responses can be higher. than people who may have experienced a secure attachment. Again, this needs to be understood with a certain amount of flexibility, because grief is an individual response and people can experience grief in many different ways. It does not always play up the way we would theoretically imagine. So, for example, a lot of people who have anxious forms of attachment or avoidant forms of attachment may not experience prolonged grief or complicated grief, and that also happens. It's only about the vulnerability factor increases when attachment relationships are more insecure. Finally, I want to talk about delayed grief. Delayed grief happens when a person does not fully experience the grief response for a number of reasons at the time of the loss. However, grief can manifest quite strongly, much into the future perhaps, when another event triggers that. So grief can build upon each other. Having multiple losses can also increase the chances of grief not integrating or a person experiencing prolonged grief. Delayed grief is, for many reasons, people may not have been in a place where they can really acknowledge the loss, and they kind of feel that need to get over the loss quickly. For example, the loss may have happened to a parent in a different country, and because of job circumstances, the person may feel that, okay, this is what I can do, but I quickly need to get back to my family, to supporting my kids and for supporting my work, and therefore that experience of grief may not fully manifest, and the experience can come back when another loss happens in the future. So sometimes people may feel that something small has happened, but they can't understand why the response is so strong. So let's say, for example, someone has a minor accident in the future. They have a minor accident, but the response to the accident can be extreme fear, can be a sense of depression, there can be a sense of low mood or an existential crisis that can trigger. But that may relate to unresolved grief from the past. As a therapist, I've worked with children and adolescents and adults in a range of different therapeutic institutes and life circumstances that they're going through. And in so many cases, I found that my clients were struggling with unresolved grief. So there were other circumstances, there were triggering events which masked the symptoms, so depression and anxiety. But underneath so much of that was loss of a loved one that wasn't acknowledged. Sometimes it was the loss of a sibling, or loss of a friend, or loss of a child, that they felt that they had to somehow get over and get back to normal functioning, whatever that really means. But because that grief wasn't processed, that grief wasn't acknowledged, and there was almost like a timeline to get over the grief, it remained unresolved. And when a triggering event happened in the future, the past also got triggered. So grief can build upon each other. So that's a little overview of the different kinds of grief. There are more as well, and sometimes different terminologies are used, but also one grief can play into the other. They're not all separate. Sometimes the symptoms and the experiences can overlap as well. But I hope this conversation allowed you to better understand the varieties of grief and the grief response. And in a future conversation, we'll also address more myths around grief that unfortunately can have a devastating impact on people if they believe those myths. And I'd like to provide a little bit more clarity on those in a future conversation. But for today, just want to say thank you so much for being here. Thank you so much for your listening, for your presence. And I really would love to invite you here and to our center in Lara and Glendalough. We have many beautiful workshops coming up. One is on Zen stories, meditation, and a cup of tea, which is a beautiful workshop, in my opinion, on self-care and self-compassion. So you'll find more information on our website, www.gardenofsacredtears.com. But for now, thank you so much for being here. Look after yourself. Take good care. I'll hope to see you again soon. Goodbye for now. Yours truly, Aman.